Hi, so the question is, how can I keep on top of the medical side of hospital visits? Well, firstly, I should be really honest and say that it's taken me some years to kind of get to a position where I leave my feelings of discomfort about talking to other people, medical professionals about my mum having Alzheimer's disease in front of my mum, to a position where now I have to talk about that in front of her. It's quite hard, that line between being there with your person who has the disease, just sort of keeping them company and being an aide de memoire, to actually becoming the lead in all that and being somebody that is the giver of information about really kind of every medical thing that is needed to be talked about. So now I try and make sure that myself and my siblings are present for any kind of medical visit, so that whichever of us is accompanying our mum, we take notes and report back to the other. So that sharing of information is really important in terms of feeding back to the family, but also we need to make sure that we're helping our mum by providing information to the medical professionals. So if I go to the doctors with my mum and they say, "Hello, how are you feeling?" Now she may look at me so that I answer for her as to how she's feeling, not because she doesn't know ultimately, but because she might not remember why we booked that visit or what the appointment's for or what we're focusing on this time. So one of us is always there for medical visits. Within that, there's a really interesting distinction when it comes down to hospital visits. So I could be going with my mum to some sort of appointment, and it might be that it's broken down into stages. So the stage one might be go and have your blood pressure taken or something and be weighed, let's say. And then the next part might be to go and see a consultant. Well, that first part, often the nurse will say, okay, I just need to come and do this, need to take your blood pressure and weigh them, you can stay there. I've had to say, no, I'm coming with my mum. Oh, it's not necessary, they'll say. And I have to say, I'm sorry, my mum has Alzheimer's disease and I think it's probably going to be quite helpful if I come with her. So I've never had any major problems, but I have had to be quite assertive about this. And I wonder to myself, am I just making a big hoo-ha over nothing? But in that situation, which was fairly recently, I went in, and what happened is something that happens a lot in hospitals in the UK anyway, is that they ask you your name, your date of birth, and some other bits and pieces, like maybe the address. So that they're double checking according to hospital procedure that they are dealing with a person that they're meant to be dealing with. I understand that, but my mum can't always say what her address is, and then there may well be other questions to do with her weight or when did she last eat, and so even with something as simple as apparently just having blood pressure taken or being weighed, there are always direct questions. So go with them, be brave, don't be like me, be assertive, because usually it helps. The other thing I started doing is, if I'm going with my mum to a hospital, I try and forewarn the team that my mum has Alzheimer's before we go into the session. So if it's, let's say she's going to have an x-ray or something, and we're waiting to be seen, I'll sort of sign my mum in, I'll get her settled down, and I'll go back to the desk away from my mum and sort of say, look, please make sure that everybody in the room knows that my mum has Alzheimer's before we go in. I have found that it has helped. We haven't quite got round this problem of, even though they all know and they change their behaviour and their attitude and the way in which they change their focus in talking to her or talking to me or knowing who to address, they still ask those same questions: date of birth, address, name. It's not perfect, but anything I can think of to do which will help ease that situation, to give my mum a better experience and to improve the clarity of information, I'm going to try and do. So that could be quite a useful one for you as well. And then the last one is what happens in retrospect if, like me, sometimes you don't do all that stuff. Sometimes, like if my mum's been in hospital for days and days and days, I just get tired of constantly saying to different members of staff, explaining that she has Alzheimer's and what that means and how to get information. And if I think that the information isn't directly crucial to her care, I might not kind of intervene in that way. I did that recently, and then afterwards was really kicking myself for not having been clear and not having made the effort. I did decide to go and talk to that member of staff after they had finished visiting my mum and say, look, I don't know if you are aware, but my mum has Alzheimer's. At which point the staff member turned around to me and said, oh yes, I just saw that in the notes. So I thought, okay, so she's telling me that she is aware, and it was a sort of an apology. It's a shame that she hadn't read the notes before coming to talk to my mum. It wasn't a critical situation, but I've sort of made a promise to myself that no matter how fed up I get with it, I have to try and really be clear in advance and not get to the situation where I'm dealing with it in retrospect. It's probably worth bearing in mind that a lot of what I've been talking about in terms of passing information and helping with information flow results from medical staff not being sufficiently trained in managing people that have dementia and Alzheimer's. I think that's changing, but it's a slow change. To some extent, it's not their fault that they are where they are at the moment and that they don't have that training and that education. I suppose I feel that to some extent what I do, what we all do in trying to explain is that we're part of that education process. That's why the butterfly scheme was set up by a carer. It's people like me, it's people like us that need to help resolve this and to explain what's needed. So be brave, take a deep breath, and be as helpful with information as you can, and hopefully it will smooth the way. If you have any more questions about managing these kinds of hospital visits, then just send me your question as a tweet to answers to ALZ, and I'll do what I can to answer it. Okay, thanks. Bye.